My name is Jess Gronholm. I am the Director of Wellness for Total Life, a teletherapy company custom built for aging adults with thousands of veteran members. And we partner with Medicare supplements and Medicare Advantage plans to provide therapy and now wellness programs to older adults who often struggle silently with depression, anxiety, and trauma. Today's conversation is all about action and not just appreciation. Our panelists, amazing people that they are, bring deep experience in creating, selling, and supporting care that honors veterans not only for their service, but for their ongoing health and wellness. First, we have Mary Ferre, the AVP of Health Solutions at USAA and co-creator of the Humana USAA Honor Plan. And yes, yes. Woo! And then we have Ron Ray, the owner of Turning 65 Solutions. Really cool name, by the way, who's personally advised hundreds of veteran families. And finally, we got this guy, Doug Teff, the VP of Field Sales at Humana, who leads the training and strategy behind how brokers engage the veteran population. All right, I got all that out. I got it all out. So let's get into it. So starting with the big one. So to all of my panelists, how can brokers ensure that they are truly serving veterans and not just selling to them? And whoever wants to kick it off, you can, Doug, if you'd like, take that.
Okay. Well, thanks, Jess. And thank you for facilitating this really important discussion this afternoon. It is an honor to be here with Mary and Ron. And it's an honor to be in front of all of you, our broker partners and agency partners. Real quick before I answer that question, how many people in here themselves served? Thank you. Thank you. And it is very hard to see with these lights, but you caught my eye first, sir. So after our session, I'll be presenting you for your service the 2025 Humana Challenge coin. Thank you for your service. Now, to your question, I think the most important thing is understanding that the veteran population that is purchasing and trying to learn about Medicare is a unique population. They are not like other seniors or other Medicare eligible beneficiaries. And so, as a producer or a broker or an agency owner, one of the most important things you can do is invest in training, and not just product training, but understanding the population, understanding how to approach and some of the questions you may want to be asking a veteran prospect you're talking with. And certainly, and we'll get into it, I'm sure, there are so many local resources and partners and organizations that can help you add a stamp of credibility to what you bring to the table as an insurance expert in the veteran space. And I think as a local broker, if that's the space you're in, you have a really unique opportunity to get into that.
Love it, Doug. Thank you so much for sharing that. And, I think just one of the first things we can all do, to really make sure we're serving veterans and not just selling to them. I'm so excited to see so many people in here because it means you care about this topic. And that's really the first thing to really care about, the decisions that they make, their own health care, and making sure that you're establishing, credibility with them and rapport, from the very beginning. I think that sometimes we have concern if we tell someone thank you for your service, that may come across as try it and just saying and not doing. But there's other things you can do also. I think first of all, I think they don't expect to be thanked for their service, but they do appreciate being thanked for their service. And that's really a best practice at USAA. And then even maybe asking them more about their service. What branch were they in the military? When they got out of the military, what was their rank? Ask them, is it okay if I call you by your rank? Some of them will like it, some of them won't, but really just going a little bit deeper. And of course, if you are a veteran, that making that connection with them, just establishing that rapport. Even at USAA, we have our agents print out the phonetic alphabet and have it at their desk. And that way they can, use that to make clarifying questions. So that's the Alpha, Bravo, Charlie, Delta, Echo. And it just goes another level to show you really care and establish that rapport.
Yeah, absolutely. And Ron?
I think it's just important to do it. One thing that I get from agents all the time, and I know that we are guilty of this as well in the early days, was have a tendency to leave veterans alone because there's a worry that you're going to mess something up for them. And that certainly is possible in some cases, but in most cases, it's not. You can only make things better. And I think the fact that you're here is really good first step. If you've got an empty seat beside you, that's one of your competitors that's not going to be as good as you when you leave here. And so take it in and then do it. Go out. Don't be afraid of them. They need help. They're very underserved. A little bit more served now, thanks to, Humana and USAA. But as a group of brokers, we need to go out there and actually be proactive about helping veterans every day.
Absolutely. That was great, Ron.
Well said, Ron.
I love the empty seat next to you analogy. So obviously there are gaps. There are always gaps in healthcare, and veterans have unique healthcare needs, as you guys know. So what are the biggest gaps in how we serve them today, and how do we do better?
Okay, I could start with that, Jess. And so, I think all alternatives or, additional coverage in addition to VA for dental, especially vision, hearing, that's what we hear when we ask veterans because, they not really the smaller group gets coverage from the VA for those things. The majority of them do not. They only get that if they have a service connected disability related to their hearing, for example. So those are important gaps that they don't have today. The other thing I would think they have, a higher instance of chronic illness. So
Right,
it's
right.
important that we're connecting them with the benefits within their plan that help them manage those chronic illnesses. And they actually have a higher instance of cancer also. So compared to their civilian counterparts, someone who's been in the service is 25% more likely to be diagnosed with lung cancer. Female veterans are 40% more likely to be diagnosed with breast cancer. So there's definitely, gaps and connections we can make for them there. And then, of course, I know we're going to talk a little bit more about mental illness and the stigma associated with that and help that we can provide there also. But we have more work to do as an entire community around veteran suicide and preventing that. And so we know that, veterans are 60% more likely to die by suicide than the national average. So those are, some of the things that are unique about them and the gaps about our veteran community.
Absolutely. How about you, Ron?
For us, it's more about being proactive about going out and finding them and helping them when we do find them. But I think the biggest part is just having, great products that fill that gap. Because, if a carrier is able to design a product that is geared towards veterans and really has veterans in mind, that's the biggest first step, really.
That's a really great point.
I would build on what Ron said in the first question. The biggest gap that exists is an intangible one, and it's a knowledge and awareness and education gap. And where you all come in is not just closing that gap from a technical perspective. Now they know what a plan that is designed for veterans looks like, but a confidence gap with your recommendation of a plan that's suitable for that veteran, that meets their needs, that can connect them with great senior focused primary care so they can take care of those chronic issues by just showing up and closing that gap. Like that's the biggest thing because there's so many people that they don't know where to start and they believe, again, I'm going to copycat you because you said it so nicely. They might believe if I do this in an MA with the Medicare Advantage plan, I'm going to screw something up with my veterans benefits. And unlikely, not that it can't happen, but I mean, there's a real opportunity to help. And I love Mary's comment about, gaps in care and clinical states. I think that's one of the biggest things that a managed care organization, a Medicare Advantage organization like Humana and others, but like Humana, can bring to the table. One of our greatest strengths is connecting people with the right resources, both from a clinical perspective, that might be a nurse on call, that might be telehealth, it might be a number of things. And those are aspects that they don't have ready access to, that when they join a Medicare Advantage plan like Humana, it unlocks all those possibilities that frankly, they probably don't even know it exists.
Yeah, absolutely. That's a great answer. And you know, in turning to building plans for veterans, when building or selling a veteran-specific plan, what's the most important thing to keep in mind? Mary,
I'll start.
I'm going to jump this show.
Well, I think, just like with any population, whenever you're building a product or an experience, you start with what you know about that group. And, what do we know about these veterans? There's about 8.5 million of them who are over 65. When we first started, USAA first started working with Humana on this initiative in 2019, there were 9.5 million. So we know we're losing them at a really, a fairly big clip. And, we also know that they can have a tendency to be in rural areas. We know that depending on whether they were officers or enlisted, there could be a fairly big disparity in their income and education. And so these are the things we know about them. I mentioned earlier some of the gaps we believe that they have. And as the companies were building out those discussions, I think what I was really impressed with Humana, they did a lot of research, focus groups, and we've since come in and done that along with y'all, and qualitative and quantitative research to make sure that we understand what veterans believe their gaps are, and what we thought, what we could help them with as a partnership. And I think that's really the important part, is knowing that member, that veteran, and then making sure you validate what you think you know.
Absolutely.
I would say stay with me here. One of the unfortunate things of the last number of years, the benefit arms race that's occurred in the Medicare Advantage industry, is it has distilled complicated, critical decisions down to very basic increments of a benefit, maybe a single benefit on a plan without a full needs analysis. So sure, you design a plan that is MA only because the veteran prospect may get their drugs at the VA, and it has this give back which defrays their Part B. All that is super important, but it's unfortunate to me that I think what's happened over the last few years is we've sort of skipped all the questions about, well, how actually do you use healthcare? When do you go see the doctor? What are you concerned about with your health? No, just I'm going to tell you what the give back amount is, and it's $5 more than brand X, so move over there. You don't do yourself a service as an expert in this industry when you appeal to that least common denominator. So my plea to you all is to take advantage of the training skills. Again, that confidence gap that you can close for that veteran prospect is telling them and asking them about all the things that are going on in their healthcare. The last thing I would just say, the product is very important. What we've tried to do at Humana is surround that product with services and partnerships along with USA that really imprint a unique experience on the veteran member. We have a customer service department that answers calls for our honor plan members, our veteran members. And every single person who picks up the phone at Humana answering those calls is themselves a veteran or a spouse of a veteran. They've walked a mile in those shoes. And let me tell you, that is so important. And we've learned a lot. Not least of which is how to engage the veteran population. We've learned a lot from USA through our great 5+ year partnership.
Yeah, absolutely. The authenticity that you're talking about, Doug, right? And Ron?
Jess, can you restate that question?
Yes, I can repeat the question. When building or selling a veteran-specific plan or experience, what's the most important thing to keep top of mind?
Yeah, so veterans are not just your normal Medicare beneficiaries. And so I think, Doug, you said it, you've got to have a fact finder and needs assessment process. And your needs assessment, or your fact finder needs to consist of more than what's your zip code. You've got to find out, you said it perfectly. When you go to the doctor, what doctors you go to, do you go to the VA? Do you have TRICARE? Because only one plan's probably going to be appropriate. And it's not just enough to take an existing plan and slap a name on it like Patriot or Eagle or Honor and call it a veterans plan. It's got to be built from the ground up with veterans in mind, because you can cause problems, especially when we're talking about TRICARE and Champ VA. It can cause problems, and not problems that we can't overcome, but problems in the educational aspect of it. And so you've got to get to know people. And I know, if we're in the middle of annual election period, we're going real fast, and you're going to hear some big numbers talked about, this week. Agents are doing 700-800 apps during AEP, and we're not doing that with veterans. We've got to take more time. We've got to take more time to get to know them, and sometimes say no.
That's a great point. Doug, so this one's all for you. Can you help us break this down? What are the key differences between VA healthcare, Champ VA, and TRICARE?
Yes, I was told there was not going to be a test today. Jams. And you hit me with a pop quiz.
I believe in you. I believe in you, man.
You. Thank you. I'll do my best. This is not a seminar on all those veterans details, but I'll hit a few highlights. And I see there's a question coming in even about that very topic. And Ron has really touched on it, that this is an opportunity for you to slow down and make sure that you really understand. And I would say, to lead into the question, at Humana, just within our sales organization, we have 250 individuals who have raised their hand in our sales organization and identified themselves as a veteran advocate. And when they do that, they get specialized training and information. So we are open and here to help. So we're your side kick on your journey into the veteran space. If you need training, if you need resources, questions, and answers, I would certainly put a plug in for that, and plenty of training opportunities available. But when you think about the different pieces here, you have TRICARE, and TRICARE itself is the name of the healthcare that an active duty service person uses, and Humana does service about half the country with TRICARE. So if you are serving in the military today on a base somewhere, Humana is very likely your healthcare provider, and that is for non-Medicare active duty. Some individuals, typically if they've served 20 or more years, earn TRICARE for life. And as the name implies, it essentially means you continue to get your active duty type healthcare benefits through the longevity of your life. For a long time, there was a belief, and in fact, I would tell you, Humana, we had this belief. We weren't sure that really it was appropriate to sell an MA plan, a Medicare Advantage plan, to someone with TRICARE for life, because there are some claims complexities, uh, but it can be appropriate. It may not be appropriate in all cases. So if you run across someone that has TRICARE for life, it's the opportunity to be like Ron. Take a minute and make sure you're asking those questions. And if you aren't sure what to guide them, then pull in your resources, whether that's your upline or people at Humana, to help you out. So that's TRICARE for life. CHAMP VA is a benefit that's available to spouses or dependents of veterans who typically have been deemed totally disabled. So that is really for spouses and spouses of or dependents of veterans. And again, they themselves can, again, it gets somewhat complicated with different levels of service. And then when folks say, what is the VA? The VA is of course not a healthcare benefit. It is the healthcare system that the Veterans Administration provides to people who have served. And again, depending on the amount of service and tenure as well as level, I think varies exactly what level you slide into. So there are various pieces. I know there's probably 10 other questions we could get into. Maybe you all want to tag on to that, but that's maybe a quick primer on some of the differences.
I think you passed, Doug. I think you passed with flying colors.
Did I pass?
I thought that was great.
Yeah.
Yeah, this
Okay.
this guy's
I was dreading someone raising their hand and say, "Not, excuse me," and I may have. Thank you.
So Mary, talking about the honors plan, what made the USAA honor plan such a hit with veterans?
Well, I think, we talked about it earlier, just the fact that, Humana went out and we talked to veterans before, it was even built. And so that's kind of how it was conceived, just with their initial primary conversations with veterans. I think also with that plan, as Doug mentioned, the partnerships they've built, I think Humana is very well known, obviously, for health insurance and the experience. Humana last year was named ranked number one on the Forrester Customer Experience Index. And that was actually, I think, your fourth year in a row to be ranked number one on that. And so they're very well known for that piece. They're not as well known for their work in the veteran community, and they do a lot in the veteran community. And so they're not as well known for that, but USAA is. And so we can add that, piece to the puzzle. And we are also, USAA, we're not as well known for our vested interest in, the health care and the health insurance decisions that our members and the veterans make, because there is a direct line correlation between that and your financial security, which is our broader mission. So I think just that partnership coming together of the two companies, I think has really made the honor plan as popular as it is. I think there's almost 500,000 policies in force now and over 50% in the market share. So it has been very well accepted in the marketplace.
Right. And then Doug, for you, from the broker and field side, what lessons or unique approaches to training can the industry take from that success?
Yeah, great question. Again, I would reflect on Mary's point here that uh, we have benefited from, being in the halo of the wonderful USA brand with veterans, and hopefully we've brought something to the table too. But that is a key partner, I would say. In addition, we have partnerships with the VFW, the Veterans of Foreign War, Disabled American Veterans, the DAV, and do many events and opportunities to help support veterans, combating hunger, face the fight, which is around mental health. We'll probably speak about that in a minute. As a field agent, what I would encourage you to do is to get involved in your community. And there's a myriad of ways. If you didn't serve, you can join, for instance, the auxiliary VFW and connect yourself in there. Get connected with these folks and show an interest in learning about what matters to them. And then secondly, I would really say, and this is a thing we've learned a lot from our partners at USA. I would say we've also learned a lot from our broker partners. Is there is a and there might be a question about it. There is a maybe a language barrier, if you will, vocabulary barrier in approaching veterans or walking into a VFW and introducing yourself. We have training for that. We can help you. We can send people out with you to help you do that. Because it is different and it can be an intimidating experience. Most of all, just like so many other Medicare prospects and Medicare eligibles, they just want someone who's looking out for their best interest, someone who truly cares about what their personal needs are and how they can help solve for those needs, and not someone that's going to do a drive-by and sell them a product and then not be there when they've got to make a phone call to someone at 7 o'clock on a Friday night. So if that's the kind of agent you are, you're going to be really successful getting yourself plugged into the veteran community. Ron, I'm sure you've got a lot of tips and tricks there too.
Yeah, so the number one tip that I can give you if you're interested in working with veterans, and you should be, especially as our space gets more crowded and competitive, and agents get better, and automations get better, and call centers still exist. It's gonna you've got to learn the other programs inside and out. You've got to know exactly how TRICARE works. You've got to know exactly how CHAMP VA works, the VA. If I get a show of hands, I can't see about halfway, but how many of you have ever heard of TRICARE Plus? You know that the TRICARE Plus is a thing. Not TRICARE for life, but TRICARE Plus. That's not a lot of hands. All right. So if you don't know, go find out. It's right there, TRICARE.mil. It's on the first page. It's not hard to learn, but it's essential. You've got to learn how the VA works. What are their options if they're in a rural area? What is the Mission Act? Because these are the points that you're going to augment. We don't want to replace anything that they have. They worked and earned and bled for those benefits. We don't want to replace that. We want to augment. And so if you come from that point of view, then everybody's going to be successful. But I'd also add that this is a high touch area for us.
Absolutely.
It's especially with veterans, especially if they're turning 65 and we're getting them at that point, it's a little bit easier because we begin the education. But if we're catching them at 75, we're about to change their whole world. And if we're in a transactional business model, it's not going to work. This is a high touch, highly personalized model, and you got to get used to that, and you have to do it. But it's a good thing. It's good for everybody.
And along that same line, what are some common mistakes that you see brokers or providers make?
Not understanding the programs.
Yeah.
Not understanding why for years there was this big misconception. I think we've almost eliminated it, but there may be somebody, some that are out there that still say, don't mess with TRICARE folks because you'll make them lose TRICARE. Well, we know most of us know now that that's not true. But do you know why maybe a PPO is more appropriate for a TRICARE beneficiary than an HMO? Do you know that? And so you've got to know both sides of the equation. You have to know them well, and not just know the summary of benefits. You've got to know the nuances of why. You have to know the why. And if you don't know the why, take the time to learn before you step out there.
Exactly. I'm going to read one of these questions off this board without my glasses. We had a question from Anonymous. How do you explain to a veteran under 65 who is paying less than $50 a month for self and spouse, now with Medicare, now has to pay Part B for each, costing more than $300 a month? Anyone?
Do you want to?
Ron? Come on.
He'd call you congressman. Sometimes that's just the
Okay.
answer. Sometimes
All right.
that's just the answer. That's just the way it is. right? That's what Medicare costs. I mean, we still get that complaint. Oh, I thought Medicare was free. Well, no, it's not free.
Yeah, I got
Yeah, and
But they are going to get the Part B
that's
give
right.
back
That's right.
that will help compensate some of the 300 a month. And, the point of the overlay of the honor plan is they're going to also get additional benefits that they're not getting today. I'm assuming this person is talking about someone who only has VA. Well, if they only have VA, unless they have a service connected injury related, to their mouth or their hearing, they're probably not getting dental, vision, or hearing. So there's other coverages that they'll get.
I was going to say that next. Yeah, it's $185, but let me get you some of that back.
All right, and then turning discussion to mental health. Many veterans struggle silently with trauma, depression, or isolation. What role can Medicare program designers and agents play in earning trust and helping connect them to support, especially around mental health?
I can start. Yeah. There's just so much work we need to do here. And, this is going to take the entire community. If you're in this room, you care about veterans, there's a role for you in this conversation. The VA will tell you that they cannot do this alone. I mean, they publish the materials regularly and they say it's going to take, all of us. It's not going to be one government, agency or one nonprofit or one, corporation that changes this. It's going to take all of us working together to meet the veterans where they're at. And in the agent community, I mean, that is a high touch community where you may hear something or be alerted to something that concerns you, that you feel like someone's at risk, specifically around veteran suicide. And I mentioned earlier the higher rates of veteran suicide. We've had 125,000 veterans die by suicide since 2001, about 17 a day. And so, what USAA has done is in 2023, we started an organization called Face the Fight. And the whole point of it is to have a platform where there's a coalition. We started with 3 members. Humana is one of our co founding members, along with Reach Resilience. And now we have over 250 coalition members. And I would ask you to go out to wefacethefight.org. There's a tab called resources, and there's a plethora of training out there. Humana's used some of the training in their value-based care system and Conviva, some of their Conviva and Centerwell locations. And, the point of it is just to be able to identify things and to know what would you even do? What would you even do? So I would just ask you to go out and look into that. And I think you'll find it very useful and you may make a difference.
Yeah, would highlight Face the Fight as one way we've tried to partner alongside USA and others, Elizabeth Dole Foundation, et cetera, to create awareness. The best awareness comes from individuals like you and who are interacting with prospects and seniors and in your communities every single day. And that's where I would say is if you want to serve this community well in whatever space you work in or whatever city, town, market you work in, there's an opportunity for you to get involved locally and show up and do things locally that can serve these veterans. 988 is the national suicide hotline. 988 is now imprinted on every single Humana ID card because it is, again, a simple thing that people just don't know there's a resource available to them that might help them in a really dire time of need. And then lastly, I would just say socially, really important that we keep in mind that all seniors really, or many seniors, and maybe particularly veteran seniors, face issues of social isolation. And sometimes that comes along with food insecurity as well. So there's related items beyond mental health that all tie to the same thing. So there are just so many different ways to get involved, whether it's nationally with some of the programs we've described, or maybe more importantly, locally in your community where you can show up as a leader and an influencer. I think that is just so important.
Exactly. And just we'll get to a couple more questions here, but before this is over, to ask each of you, I'll start with you, Ron. What's one thing you wish every broker knew before sitting down with a veteran client?
Veterans have historically been underserved, at least in my observation, by the Medicare community. And they're no different than any other Medicare beneficiary. In fact, I believe that they need and deserve more care, not only from the insurance carrier side and the healthcare provider side, but from their agent broker side as well. They need more support. Just what we were talking about in when we were getting ready to come out here with the mental health aspect, I even hesitated a little bit myself when we were having that discussion about,
Yeah.
how do you bring up mental health when you're in the middle of a sales presentation? Well, I mean, it's an uncomfortable subject, and it's stigmatized, and so just understand that they need that help. In most cases, they want that help, and in a lot of cases, they feel ignored, especially if you're still dealing with Vietnam era veterans. It's even more so. Now, most of our turning 65 people are out of that phase and on into, you know, Gulf War era, but they're no different than Vietnam era soldiers. So get to know them and don't be afraid to help them. Go help them even more.
And Mary?
Yeah, what I would, I guess, add is, if what I would wish that all of us agents and brokers, know about the veteran community. I think we've been talking about it, frankly, the whole time. And that's just really there's two things to me that are really important when you're having a conversation and doing your discovery with a veteran. First of all, that they know what they have. And we find at USAA, the majority of them do. It is complex, but the majority of them will know, for example, what priority level they are on the VA, if they have TRICARE for life. I mean, they'll know what they have and they'll want to take an active role in decision making around their health care. But for us on the agent side, educating ourselves, I see question about where can you learn? Doug's talking about training that Humana offers. And frankly, it's not hard even to find, just out there. The VA has a site, that it's pretty clear and you can go through that. But just taking the time to educate yourself. And even then, taking, Ron's talking about, sometimes it's uncomfortable taking that first step to have that first conversation. You'll get better with every conversation. You'll build more and more rapport. But I think that's the critical piece. And you may, because everybody's choices are going to be different based on what they have. So it's really important, what works for one person who has TRICARE for life. They may not want a Medicare Advantage. It may not work for them, but for someone else it does. So I think kind of just circling all the way back around to saying thank you for your service and showing more of the do and not the tell. You may have an hour conversation with a veteran, and at the end of the day, the two of you may decide, it's you may not make a sell. It may not be the best fit for them, but that's kind of the do and thank you for your service. That's really showing them,
I love
hey,
that.
I care about you, and we talk through what your needs are, and here's the best thing for you. So
Nice. And Doug?
I would just say every one of you in this room that serves Medicare eligibles, not just in the veteran space, but particularly in the veteran space, you have a unique opportunity to differentiate yourself. Don't just be a drive-by product peddler. The give back's really good on this plan. It's the one you should buy. That's what everyone else does. You should do something different. And that should be all the things that Ron and Mary just talked about. And if you don't know or don't even know where to start, it's okay. We've got people here to help you, here to train you, here to get you connected with the resources. Find yourself a mentor in this space. Maybe Ron will want to do that. Like, I mean, if I were, your phone's going to ring off the hook. But if I were you and I wanted to get in this space, I'd probably figure out how to get a hold of Ron Ray. Probably that's one of the first things I would do.
Absolutely.
It's okay to not know what the exact right path is, but I think the more you invest in just being a real advisor for your customers and not just the person that sold them a plan and they'll check back with you next September when the ANOCs come out, I think we should hold ourselves to a higher standard.
Absolutely. And I want to squeeze in one last thing because our time is almost up. This is a great question. Do you see more opportunity in changing benefits for female veterans and a bigger opportunity to serve?
I definitely do see the opportunity. That is a great question. And what I think that we'll continue to see benefits and working with Humana on the plan evolve and evolve and evolve. And but I love that. That's a great something we should, consider.
Yeah,
Yeah.
it is. Thing to have.
All right. Well, it looks like that's anybody else.
I think we're at time.
I think we're at time.
Yeah. Thanks,
All right. Thank you, everybody,
Thank you,
for
everybody.
joining us today.